We started here, and we've been in operation here for 23 years now, employing Newfoundlanders and Labradorians right throughout the province. Our staff work remotely or in one of our offices in Corner Brook, St. Anthony, or here in St. John's. Our leadership team that oversee all of our Canadian, U.S., and international operation are based here at our St. John's office. In the United States, we have registered nurses licensed in each and every state, providing very similar services to that of 811 here in the province. Our clients there include physician practice groups, community health clinics, small rural hospitals, health plans, some very large employer groups, universities, and many, many others. We also offer remote biometric monitoring programs there for patients with various chronic illnesses, enabling us to care for them in their own homes through the use of technology. When a patient experiences a problem, an alert is received and responded to by a staff member right here in Newfoundland. We serve over 15 million individuals in the U.S. alone today and manage in excess of 30,000 triage and health information calls every month. All this while maintaining our home base here in Newfoundland and Labrador. In addition to providing a healthcare service, FOMED is also a technology company. Our nurses rely on a comprehensive software platform that was developed right here in St. John's by software developers employed by FOMED. This is software that's now being used by clients in other parts of Canada, the U.S., the Caribbean, and throughout Latin America. Most recently, our software was adapted as an integrated aspect of the province's COVID-19 response. This pandemic was not our first time responding to a health crisis. We were involved in the SARS outbreak in 2003, H1N1 in 2009, and we responded rapidly to support our client needs in New York City during the 9/11 terrorist attack. These experiences positioned us to be retained by the Center for Disease Control in the U.S. to assist them with their pandemic preparedness and bioterrorist response plans. Never in a million years, however, could I ever have imagined rolling out a pandemic plan in our home province. This has been a very busy time for us, as I'm sure you're all aware. We were just recovering from the demand for service related to Snowmageddon when we were called upon to mobilize our pandemic response. Within 2 weeks, we transitioned all of our employees to work from home. We updated our software algorithm and installed multiple iterations of the provincial self-assessment screening tool. We provided daily collection and dissemination of influenza-like illness reports and call data for the province. We hired an additional 100 registered nurses and frontline intake staff in Newfoundland and Labrador alone to meet the public's increased demand on 811. By the way, we also had to respond in similar form on our U.S. operations. And we increased the capabilities of our team through the introduction of nurse practitioners. The addition of nurse practitioners allow us the ability to expedite the care process where possible. In all, we advertised, recruit, trained, and moved to a work-from-home strategy, securing the necessary equipment for more than 250 new employees and operational staff, all within 14 days. To put this all into perspective on why we had to ramp up so quickly, from a service delivery viewpoint, at times in our province alone, we had 150 calls a minute coming into the HealthLine, not an hour, a minute. So we ended up handling 700% more calls than we had at the same time last year. There were obvious challenges in responding to that unprecedented volume demand. But our team of dedicated healthcare professionals rolled up their sleeves, working day and night along with us to ensure the appropriate direction of care. We worked very closely with the Minister and his staff, the regional health authorities, and the Newfoundland and Labrador Centre for Health Information to get the job done. And that brings me back to why we're here today and why I'm so happy to announce that we have now had the addition of nurse practitioners to our 811 line to support our current medical care system. During the last few months, as we unroll this new program, it has proven already to be a major benefit in the provision of acute episodic care. Residents right throughout Newfoundland and Labrador now will benefit from this innovative advancement by providing an integrated access point for healthcare services. This new expanded virtual care service is available from the comfort of one's home simply by calling 811 or by utilizing 811's HealthLine app. Our registered nurses can assess, triage, and provide information to callers, while escalation to our nurse practitioners can diagnose and treat various acute care conditions. Virtual care is the world we live in. It is through collaboration with the province and our partners and communities throughout the world that we enable healthcare access for one and all. I would now like to introduce you to Kevin Hillier. Kevin is our Chief Information Officer to provide a technical overview and a brief introduction to the 811 HealthLine app. Kevin?
Thank you, Charlene. I'd also like to thank you, Minister Haggie, for your kind introduction and for obviously the opportunity to participate in this announcement. As Charlene referenced, PhoneMed has been a leader in the telehealth industry for 23 years, and we've been lucky to leverage that experience as we pursue innovative ways to evolve our technology in support of our clients and our patients. Over 15 million people have access to our services, and that access is supported using technology developed right here in our province. Throughout our evolution, we've learned that success is only possible when technology supports a positive patient experience. That is why I'm very excited to have the opportunity to introduce this innovative technology that will be used supporting this new virtual care program in the province. So I have a quick slide presentation that I'd like to go through. So in addition to traditional phone call, access to a nurse practitioner is now available via chat and or video through a new downloadable 811 HealthLine app. The app is available for Android and Apple smartphones and tablets and can be downloaded from their respective app and Play stores. Access to a nurse practitioner is appointment-based, and patients will have the ability to book an appointment directly via the app when refilling prescriptions for chronic conditions. And for patients who are sick and or have symptoms, they will first be accessed by a HealthLine registered nurse. An appointment can then be booked with a nurse practitioner if appropriate. If you are a parent or caregiver, dependents can also be added and managed within the new app. If the nurse practitioner feels a prescription is warranted, that prescription is sent electronically now to a pharmacy preferred by the patient. Patient privacy and overall data security is our top priority, and it is at the forefront of everything we do when creating innovative technology solutions. Our platform, including our new HealthLine mobile app, ensures that data is securely encrypted when stored and while in transmission. Our technology fully complies with PIPEDA, which is federal privacy legislation, and FIA, which is our own provincial legislation that ensures appropriate policies and safeguards are in place regarding confidential personal health information. As I mentioned in my initial remarks, we have learned that success is only possible when the technology supports a positive patient experience. That is why we have focused our efforts on creating an intuitive, user-friendly app that is completely focused on providing that positive experience. As you can see, we have focused on smart devices for good reason. This chart illustrates the number of Canadians who have at least one smartphone and use it at least once per week. So I wanted to quickly provide a few screenshots of the new 811 mobile app. And as you can see, if you have not yet downloaded it, it is available via the respective app stores. Once downloaded, the registration process is very straightforward. Appointments can be booked either again for chronic prescription refills or symptom-based assessments. So, once again, I'd like to thank you, Minister, and your entire team for this opportunity. We are very excited to launch this new enhanced service, and we are looking forward to continued innovation through technology going forward. And before handing it back, I would just like to show a quick promotional video for the new HealthLine app.
Welcome to 811 HealthLine. Newfoundland and Labrador's virtual care clinic app is now available in the Apple and Google Play app stores for download and easy registration. Book your appointment securely on the app. Schedule a video, phone, or chat consultation with one of our nurse practitioners for issues such as fever, sore throat, or urinary tract infection, and many other non-emergent issues. 811 HealthLine app is now available for free in the Apple and Google Play app stores.
Minister.
Thank you very much. This is groundbreaking. It really is a beautiful mix of local technology, of local innovation, and a made in Newfoundland and Labrador solution. We had identified gaps in primary care, prescription refill, chronic disease management, and this offered itself as a partial solution to that. Precipitated by the pandemic and the ramping up of HealthLine, it was an ideal opportunity to build a system in response to those various triggers. And essentially what we now have is a virtual walk-in clinic available to any Newfoundlander or Labradorian by phone or by chat or by video. And we are the first province in Canada to make this available across the jurisdiction without any barriers. And I think this deserves a mention all of its own. The appointments will be available from 8 a.m. to 8 p.m., 7 days a week. For those with symptoms, for obvious reasons, they would be triaged through a registered nurse first to make sure that a nurse practitioner appointment scheduled would be appropriate. Availability may actually allow an appointment literally within an hour or so. The reference was made to electronic prescriptions. These again are the way of the future. They reduce and they eliminate transcription errors, and there's been work done behind the scenes to ensure full compliance with the requirements of the various boards and colleges. Controlled drugs, however, cannot be prescribed by this route, and that will require a more traditional approach currently. The nurse practitioners who will be managing patients in this virtual walk-in have complete access to electronic health record, they have access to the pharmacy network, and they can also have access to diagnostic tests so that patient care can be as comprehensive as possible, bearing in mind it's delivered through virtual means. And it will also allow coordination between care providers, as once the phone med record is linked in through NLCHI with the patient's provincial electronic health record, any practitioner with appropriate access will be aware of the interaction between nurse practitioner and client. The appointments, as you've heard, can be booked in the conventional way by telephone or through this app, which downloads very quickly and works very well. I've tried it myself already just as a dry run. And it really is truly a convenient way of dealing with health issues that don't require a visit to emergency department and yet need some timely access. This can be a solution to a series of challenges that the healthcare system has faced. We actually launched this quietly in May, and as of the last data that Charlene's team provided and my staff forwarded, there have been over 1,100 such encounters documented, and we're certainly keen to go back and look at the results of that in terms of patient satisfaction. But what we have heard from other surveys more generally is that virtual care like this is extremely well received. It's very patient focused, extremely patient friendly. And it's really important now that we look towards this. The Newfoundland and Labrador Medical Association have been very keen on virtual care and have been very helpful in trying to advance that, particularly during COVID-19. And we'll build on that to try and enlarge this service over the course of the coming months and years. So again, I think the highlights here are this is a built-in Newfoundland and Labrador solution. It's a local company with a global reach, certainly a continental reach, that has a background in healthcare and technology. And it's a very good synergy. And I'd like to take this opportunity, if I haven't before, to thank Ms. Brophy and her staff for the really phenomenal work they put in over the course of this pandemic, when, as she says, you were getting 150 calls essentially simultaneously. And we have beaten down any backlog there to the point where today, for example, there are no clients who've called 811 who are waiting callback from a registered nurse at all. So with that, I'd like to pause. It's available from the app stores, whether it's Android or Apple, and just open it up now to the media. And I think Kathy Mystics-Payton is going to moderate. So thank you very much.
Thank you, Minister. We want to thank the media representatives who've joined us for today's event. We have 3 reporters for the call. First question comes from Ben Murphy of VOCM News. There is an opportunity for 2 questions and 1 follow-up per reporter. Go ahead, Ben.
Thank you. Mr. Mrs. Brophy or Mr. Hillier, could you just give us a quick breakdown on the process people will go through when they first use this app?
Sure. Kevin, do you want to speak to that?
Sure, yeah, absolutely. So like we talked about, the app is available on the Google and Apple Play stores. The download process is very straightforward. First, the patient would search for 811 HealthLine. They would install the app. Obviously, if it's the first time, they would go through a registration process where they would provide their email address and some other information to complete that registration process. Once that's completed, they'd have access to authenticate to the app, at which time they could then associate either themselves or, in the case of dependents, to the app. And from there, as you've seen in the presentation, the process for booking an appointment, whether that be prescription-based or for symptom-based assessment, is very straightforward. And like we talked about, the design of the app was purely focused on ensuring that positive patient experience. And thus far, with the users that we have on the app, that feedback has been pretty positive.
And Minister Haggie, in a nutshell, how is this going to help Nan and Pop or John and Jane down the road?
Essentially, they pick up their phone or their iPad, they log into the app, and they go through the process. Either it's a prescription refill or it's a separate button, and they would be triaged then to a nurse practitioner. They can either do that using their phone as a phone, or they can use their phone as a video chat video conference terminal through secure links, as Mr. Hillier described, and have a virtual consultation, a discussion about their health needs with a registered nurse, and then, if need be, a nurse practitioner who can do all the things that nurse practitioners do. This is not a substitute for the continuity of primary care as provided in a more conventional clinic setting. But what this is to deal with one-off prescription refills, with acute episodic issues where access has always been a challenge. This is advanced access for those of you who study these kind of things, and it's basically a drop-in, a walk-in clinic for acute episodic illness.
And are there any concerns for the many seniors across our province who might not have access to the types of devices needed for this app, or those, in areas with poor cell phone service?
They just use a landline. And they call 811 and say, I need a prescription refill, or I'm having A, B, and C kind of problems. And then the RN will triage those symptoms and, if appropriate, pass them on to a nurse practitioner, either then, if there is availability, or will organize an appointment and advise them of that over the phone. They can do it either by phone, they can do it by chat, or they can do it by full video. It's up to them and up to their internet connection.
Great, thank you.
Our next question is from Leila Baudouin of NTV News. Please go ahead.
Hi there. Minister Haggie, this app, much like the new online learning approach of getting an education in this province, does rely on a resource that not everyone has, a reliable internet connection. Suggestful Ben Murphy, they can use the phone, but looking through this PowerPoint here, there's video chat and different privileges that we see within the actual 8 capabilities. Do you have any concerns that this new, as you described it today, groundbreaking app might further challenge people already living with resources that are limited in rural communities?
It was a little difficult to get some of that, Layla. I apologize. The line was a little bit iffy. My understanding of the question was around internet access for more rural areas. That certainly has been a challenge, and I know my colleague in TCII, Minister Davis, has been active with the federal government to try and promote rural broadband, because that's certainly what you would need for video chat. We recognize that's a challenge, and I'm not sure of the exact percentage of people who are affected by poor or unreliable internet service. I'm sure we could get that figure for you. But for them, there is the ability to have the same virtual experience only by phone, which is available now currently through a family physician or a nurse practitioner. But this is an add-on service and would obviously be of help for those people who are challenged to find a primary care provider. If there was another element to your question, I'm sorry, I didn't quite get it from the telephone. It was a bit fuzzy.
Well, there you go. An application or video or face would add to the experience, maybe, which is what I'm trying to illustrate in my question. You said again today, Minister Haggie, that the wave of the future will be electronic prescriptions, children learning online. We're hearing over and over from your government. But other than promoting the federal government, hey, people need internet, what work is actually being done so that people living during COVID-19, during this digital reliance on the internet, aren't missing prescriptions, or children are getting an education? I don't think for them it's good enough to hear, well, we're talking to the feds about getting you internet.
Well, we have 90+% coverage, I'm told, for internet, broadband. So obviously that is a good starting point. You're quite right. There are initiatives through TCII with communities, and you've seen community groups to get grouping together to work with internet service providers like Bell. And you've seen on the Northern Peninsula, for example, where a new cell tower was installed and provided internet coverage for the tip of the Great Northern Peninsula. There are other initiatives like that. And indeed, provincial government is working on potential access to broadband ultimately if there is a gap from the feds. But there has been an undertaking from the days of previous federal governments, as well as this current one, to do something significant and build on broadband. And you're right, COVID-19 has highlighted the challenges for students working from home who require content over broadband in some of the more smaller or remote rural communities. I have one in my own district, and it is a challenge because currently internet is provided by commercial entities, and that has driven the location and provision of service.
Okay, so for my follow-up, we're hearing over and over again from a group on the Northern Peninsula asking if government can mandate Bell to put in those upgrades. The Northern Peninsula has copper, not fiber lines, and that seems to be a problem for them. So is there anything government's doing or can do to fix that so that they do have internet solution? And I must tell you, Minister Haggie, I've been back here for 5 years now, and I've done this story once a year since then of these communities who have been asking for this internet connection. So 5 years is a long time, and with the speed of the digital communications that your government is introducing, it doesn't seem fair that something will be done to get that internet connection before, once again, we're giving another app or internet-reliant government mandate.
No, I appreciate your frustration. The facts of the case are you're probably asking the wrong minister. My mandate is Health and Community Services. We have been operating within that mandate, and I don't wish to be at all disrespectful or dismissive, but my mandate is Health and Community Services.
Okay, thank you.
Our next questions are from Ryan Cook of CBC News. Please go ahead.
Question for Dr. Haggie, first of all. Will there be additional nurse practitioners hired to handle this?
That question would be in detail best addressed by Ms. Brophy or Ms. Hillier from PhoneMed. The short answer is yes, there have been to provide this service because it wasn't there initially. Currently, it's available for 12 hours a day. Charlene, I don't know if you want to add to that.
So really, we're going to monitor the demand for service very carefully, and that will really drive the number of FTEs that we're going to need in order to provide the service for the line. Right now, we have 8 nurse practitioners available from 8 a.m. to 8 p.m. Sometimes it runs a little later if they get behind on their calls and so on, but we're going to just monitor the demand very carefully and respond, if the demand is there for more.
Right on. And does this work as, does it kind of take the urgency off the need for more family doctors in the province?
No, I think this is another tool in the toolbox. Primary care is a team-based, collaborative endeavor. This is to deal with one element of that, which is acute episodic care. And just as you have walk-ins in various communities at local clinics or in St. John's, this is a virtual version of that as an adjunct to 811. It was a logical place to put it. It integrates a call for education and information, and then builds on that for those people who have concerns that can't be met that way. 811, if you recall, originally was set up to try and help alleviate demand on emergency rooms. And PhoneMed's data suggests that of those individuals who would call having intended to go to an emergency department, that using PhoneMed the way it was constructed before removed that need for 60% of those callers. I think now with the add-on of nurse practitioner and the option of prescription renewal and virtual consult for ailments that are potentially self-limiting and screened, that you will see that number fall even further. So this will help out-of-hours emergency rooms, which have become the safety net for primary care.
And for Ms. Brophy or Mr. Hillier, we're living in a time of data breaches and things like that. Can you run through the security measures on the app that will protect people's information?
Absolutely, and as I referenced earlier, we're in full compliance with PIPEDA, which is the federal legislation that manages control over personal health information and security, and we're also compliant with FIA, the provincial legislation. But from a high-level perspective, as is the case with our traditional health management platform that we've used here in the province for several years now, the mobile app kind of leverages the controls that are in place with that existing platform. So when users register, they are required to use passwords that are complex. When they enter that information, the end-to-end transmission of that data is fully encrypted, and any data that they input into the app is also fully encrypted while at rest. So at no point, whether it would be when your data is being transmitted or while it's in storage, would it ever be in a state that is unprotected or unencrypted. So we've been very careful in designing our platform and the architecture to ensure that security.
All right, thank you very much.
Thank you very much. The time for questions has ended. Any further questions can be emailed, and or phone in for your questions. Thank you very much. Have a great day.
Thank you.
Welcome to 811 HealthLine. Newfoundland and Labrador's virtual care clinic app is now available in the Apple and Google Play app stores for download and easy registration. Book your appointment securely on the app. Schedule a video, phone, or chat consultation with one of our nurse practitioners for issues such as fever, sore throat, or urinary tract infection, and many other non-emergent issues. 811 HealthLine